Hey hiker family and everybody else tuning in. So this is going to be the first video in a series I've been wanting to do for a while for both thru hikers as well as the patients I'm leaving behind that I don't necessarily have really good referrals for, as well as just a supplement for those folk. And that if you have something that's hurting you, causing some kind of problem, maybe you're on trail and maybe you have a repetitive stress, pain coming on, or just something's hurting and it doesn't seem to just go away right away, I'm going to do a few series of videos or a series of a few videos on, okay, here's an area that hurts just in general, here's something you can do and try, and there's a good chance it will help, and go from there. So when it comes to thru hikers, and if you're 50 miles from the nearest town or more, or just trying to avoid having to see someone in the first place, these may be some options that will keep you on trail. I will throw out two things to start with though. One is that watch the boilerplate video first down below or in my channel, because it probably won't be on the recommended list, because that has a better idea, or it's going to describe more about me, what I do, how this stuff works, because this is all a form of functional neurology for physical therapy, and it takes some explaining to make any sense necessarily, and I'm not going to take the time in every video to do that, as well as more information on who I am and all that kind of background stuff and more in-depth disclaimers. So you were being told, go watch that first. This video is also, however, for a bunch of my patients that I'm leaving behind, where I have a good referral list for everyone, but some of the most appropriate people are not close or not affordable necessarily, and so I wanted to give some options for you folk to tidy over while I'm gone for up to 6 months. So that's basically what this series is, and today is going to be the head-neck video. It's probably the least relevant for most of you thru hikers, simply because you're not walking on your heads, probably, but it's still something that can come up. This is much more for my patients, but there'll be more to come, and it's the first video because, well, I don't need a body model to actually describe and do this one for you guys. I can just talk into the camera, so it works pretty well. So, the disclaimer I will add onto each video though is that either I am not your therapist, or you're a patient of mine but I haven't been able to look at you because I'm somewhere on the Pacific Crest Trail by the time you're probably looking at this. So you may have an actual injury, you may have something serious, this may not be appropriate homework for you, and I cannot say that. I'm just giving an option that may be able to help some people, but it's used at your discretion. If you have any chance that you think you might have an injury or more serious health issue, go get it checked out. You thru hikers, you should have travel insurance. Injuries are covered, just go. Okay, that part's done. So, when it comes to the overall approach of this homework, most head-neck issues, let's put simply to add any explanation, are a lack of stability in the upper neck, which causes some, let's say, positional and functional dysfunction in how the neck is held and used, and affects the skull and a bunch of other stuff, all the way up to cranial nerves that may be messing with your senses, whether that's actually something as crazy as your sense of taste, but more likely equilibrium, hearing, headaches, migraines, neck pain, jaw pain, ringing in the ears, wide range of things that can go wrong simply because of something from here up. And for most people, the most profound thing we can do to improve that stability is lower the activity of this stuff and get the front of the neck working properly so that the brain doesn't have to severely compress the neck, limit range of motions, and lots of crazy stuff that, again, like I said, I could go way into and does take a lot of explanation, but I'm just going to leave it at that today. Which means the actual approach I would have you guys try, were this appropriate for you, again, I can't really say that, but for most people it would be, is that 3 to 4 times a day. With thru hikers you can go probably more frequently for most of the videos we're going to go over, because you're simply doing an enormous volume of physical work every day. But it's also if you're not stopping every hour or two to take your shoes off, take some water, and give your feet a rest, you probably should be anyway, and during which you could be doing some of these things. So 3 to 4 times a day, or for thru hikers, every time you take a rest, just go through it. I will say specificity matters. Don't just kind of grab bits and pieces of this. It has to be done as given, or it may cause problems instead of helping. So we're kind of reorganizing how your neck and skull work, and if you just kind of basically go, well, the body should be using plan A, it's been using plan B, we're taking that away and trying to get it to go back to plan A. If you don't do it right, we've taken away plan B, it doesn't want to go plan A, it goes plan C. So either way, explanation of that over. See, I spend my whole professional life explaining all this, so it's hard to resist, even in videos where I don't want to do it repetitively, because we're going to be doing several of these. So, through hikers, whenever you take a break, minimum 3 to 4 times a day, preferably more. The rest of you, 3 to 4 times a day. You know, those who aren't doing a marathon every single day. So, what the 3 to 4 times a day means is we're going to be working on 3 groups of muscles. For those who want to go look at pictures, temporalis, masseter, and then the suprahyoids. And so how we're going to approach this is, to get a notion of what we're actually working on, I'd have you put your palms over your temples, nice big area, and clench your teeth just enough to feel that muscle pop up. I would not want you to do this every time because it kind of counteracts what we're doing, but just to get a feel for it. Same with the jaw muscles. You bite down, you can feel what goes top, pops up a bit. Those are what we're working on here. This is takes a little more of an explanation. So with this, I tend to suggest people just use broad palms to gently work that, almost if you had like a stress headache, and take like a good minute going through that thoroughly, but not really heavy pressure. Every single release we would have you do is if 3 out of 10 is where it goes from really, really uncomfortable, discomfort, but no actual pain, and 4 is first pain on that pain scale, you could get like a 3.5, 4.5, but I don't want you to use enough pressure where it really hurts. Even if it feels like you're barely touching it, we gotta be no more past that threshold, so it's pretty gentle. And also one bit of detail is that we tend to think of our skulls as fused, which for one is not true. But especially the sphenoid bone, which is your temple, that kind of freely floats a bit. You can push that and feel it push out the other side. You're not going to pop it out of your skull, but let's just say it's not a good thing, which means I don't want direct finger pressure here really. Palms or kind of a flat of your thumb not going directly in, but kind of at an angle is a better way to go about that. And lastly on these is that you have to go slow. If you're rubbing on it like this, you will actually make it worse. It has to be that slow kind of movement, this exact kind of speed. Otherwise, you're basically exciting nerves instead of relaxing them, and it just pisses things off, so don't do that. So, that muscle, I would kind of switch to fingers as you come down to the end of it, in front of the ear, not the ear itself, and continue down through the jaw, where typically I will do some just small kind of round circle patterns and make sure I get all the way through this. Do note near the end in particular, there is a nerve, so just go gentle. You're not going to injure yourself, but it's not going to feel good. So just be careful there. And then lastly is those suprahyoids. This is a little bit hard to demonstrate on myself because I have a beard, if you might have noticed. It's real, that hurt. So what we're looking for with the suprahyoids is, I'm not having you push on the throat. What we're trying to do is, this is the outside of the jaw, the mandible. We're trying to work on the inside surface of it. So not this, but here's the inside, the outside, we're working on the inside. So if this were the edge, this outside, this inside, we're like scooting up, almost like trying to scoot a piece of gum off the inside of it, like under a desk. And if for some reason you felt like doing that. So I typically would start kind of at the back, tips of thumbs, and just gently, slowly, and very gently. You have some glands and some nerves down here. It's going to be tender for most people anyway, especially if they have a reason to do this video. So treat it gently, and we're just going to slowly work our way all the way forward. And so overall, the releases here should take 2 to 3 minutes to do all 3 of those. You could go a little bit more thorough, but remember, slow movements, gentle pressure. We're not busting through tissue. And then the last part of the homework is fairly simple. I would ideally have you laying face up for this. Pretend I'm laying down and that's the ground. I'm going to, again, ground, not that. Gravity is that way now. You're going to be lifting and tucking your chin nice and slowly, sitting it back down on the ground and repeating. So again, gravity has to be that way, otherwise you're doing the opposite thing and working this instead of this. The important thing is the moment you get any fatigue, you stop. And I don't mean cresting a summit, lifting weights, running fatigue. I mean, oh, I couldn't do that forever. I was a little bit tired. Done. You literally stop there. Afterwards, I would also add in a gentle rotation where it's not just like looking to your right. I want you to use at least enough muscle effort to feel like you're pushing into it a little bit. But if there's any pain, you stop there. You're not trying to push really hard to get to it, push through like some stiffness or something like that. I just want you to be able to feel it muscularly. And just back and forth. You get any sense of fatigue, you stop. This one might be a bit hard to feel some fatigue, so with that one, no more than 5 per side, then stop anyway. In that whole cycle of the 2 to 3 minutes of work on this, and then those neck flexions, the neck lifts, and rotations would be the entire homework, and you do that 3 to 4 times a day, or through hikers, more. As with all of these, again, it's under your own discretion, disclaimer, 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 but if you're doing this for a few days, and it's not surprising to have some stuff be more tender for a few days, a little bit of weird symptoms as things reorganize, including even to a degree balance, because we're potentially changing how your upper cervical, your upper neck is functioning, which is part of balance. But if you get a good several days in and either you get worrying or aggressive symptoms, the pain is getting worse that you're worried about, whether that's headaches, jaw stuff, etc., or you get like a week into it and you literally don't feel better, then this just probably wasn't accurate for you. If I had you in here in my office, we check specifically seeing exactly what you need and we'd be treating that. But as you're not, we're just kind of throwing what for the vast majority of people would be part of my approach and seeing if it helps. None of this is going to work on big picture stuff. It's not going to deal with the cause of this. But especially for you through hikers, that doesn't necessarily matter because you just need to get through, and then you can go see an appropriate practitioner afterwards and deal with deep issues that are actually causing these pains in the first place, because it's even people doing a marathon a day, as long as they didn't, do 2 miles yesterday as long as they've ever done, and now they're doing 28 today, most issues are not actually from that volume. Some, and to say the least, the volume can make things worse. But the fact that people can get through a through hike without plantar fasciitis and shin splints and stuff like that means the dysfunction is usually something deeper. So either way, without making this video longer, that's something you can try. I'm not going to repeat the disclaimers. Watch the boilerplate video and the introduction to these series and all that, and listen to the disclaimer during the video. And if you have questions, ask and I'll do what I can. But chances are, while you're out there giving it a try, so too will I, and I will not be able to necessarily comment. So until then, shoot me any questions, and we're going to be going over a foot, ankle, shin, calf video shortly, because that's all going to be bundled together. We'll do a knee video, a hip and back video, a shoulder one because it's really easy. I just have an appointment showing up momentarily, where I do it now, and we'll go from there. So if you're interested in these, stick around, like, subscribe, and I will see you in the next one.